grounded in Primary Care Progress's relational leadership framework, the Relational Leadership Institute not only builds individuals' capacity to lead, it helps to spread a new set of ideas, ideals, and identities that advance a fresh type of leadership in healthcare.
It's a tough time in healthcare right now. I think a lot of people are running on fumes. What I personally experienced at the Relational Leadership Institute is an antidote to that.
Over the course of the 3-month program, participants receive hands-on training with real-life application and coaching support they can bring back and share with their teams. RLI is a learning collaborative with people at all stages of health professional training and from a variety of primary care professions, working together to develop new leadership skills designed to transform healthcare and health.
Because RLI is both interprofessional and cross-generational, including students and faculty in a variety of disciplines in primary care, it has a wonderful tendency to break down the silos and hierarchy that can sometimes exist in healthcare today.
So to me, it's the relationships and the lack of meaningful relationships that are driving burnout.
The Mayo Clinic, their recent data seems to suggest that when you lose a physician to burnout or turnover, the cost total is somewhere between $500,000 and $1 million. So this is hurting their bottom line. And we really think that they're going to see the Relational Leadership Institute as an important piece of the puzzle to getting them back on track.
And the framework itself not only talks about teaming and how individuals work in partnership, but it also talks about their own self-awareness. So understanding who I am, where my strengths are, where my opportunities are, and then how that sort of folds into the team.
So we really got to ideate and explore what would really be a true value added in an institution like OHSU community. And in this case, it's the community of healthcare. I think we forget how important community is.
One secret to the Relational Leadership Institute's success is the RLI Leadership Pathway. Beginning first as RLI participants, this group of trainers and facilitators works in partnership with local RLI leaders and Primary Care Progress's national training team to bring its relational leadership curriculum to life.
I think that it creates space for other kinds of voices to rise to the surface.
I think that it mitigates some of the burnout experience and it really elevates their teams to a higher level. And I think that ultimately their patients really benefit, which is why we all do this in the long run.
The happiest parts for me in healthcare is when I sit with a patient or a community member and I don't feel that traditional provider-patient hierarchy.
Getting relationships right is critical to both success and satisfaction, and we do believe that it's the key to a sort of lasting change within healthcare.
I really do feel optimistic about the future of medicine.
I'm incredibly hopeful for the future of healthcare. When we get a group of people working together on a common goal and they feel connected to each other, we're unstoppable.
The Leadership Pathway cultivates connection, collaboration, and community in each learning collaborative, while also serving as stewards to support the continued growth and development of one another.